My doctor confirmed that I have diabetes? How is this even possible? I thought I was healthy. And now I have to use insulin? I can't remember how to use it. This is all overwhelming. What I'm going to do? Oh, right. I remember Jojo mentioned before that she has a diabetes and uses insulin. Maybe I should ask her about it.
Hey Mela, what's up? Why did you call?
There's just something on my mind. I had a checkup earlier and the doctor confirmed that I have a diabetes after looking at my lab results. It's just messing with my head. It feels like it came out of nowhere, especially since I thought I was healthy. On top of that, the doctor advised me to start using insulin. Is it using insulin for serious cases? Is it the same for you? Also, I can't remember how to use it. My mind is all over the place.
Mela, take a deep breath first. I know it's a lot to take in, but don't worry. There's an answer to all of your questions. First, using insulin doesn't necessarily mean your condition is severe. Using insulin is one of many ways to manage your diabetes. You might understand it better if a professional explains it. I'll send you some educational video to help grasp your situation.
Really? Thanks a lot, Jo. I'll be waiting for that.
Sure, I'll find it for you.
Hi guys! Welcome back to another video of Health 101. And for today's video, we will tackle the topic of insulin and how it affects diabetes. What is insulin? Insulin is a hormone produced naturally by your pancreas that helps regulate your body's usage of sugar for energy. If your pancreas does not function properly, it may not produce or release the insulin required to control your blood sugar that can lead to having diabetes. How does insulin work? Insulin transports glucose from the bloodstream to cells throughout your body. Glucose is obtained from the food as well as from your body's natural release of stored glucose. Insulin helps in the regulation of blood glucose levels. When there is an excess of glucose in your bloodstream, insulin signals your body to store the excess glucose in your liver. The glucose held in your body is not released until your blood glucose levels fall. Without enough insulin, glucose cannot enter your cells and instead builds up in your blood, which can lead to hyperglycemia. Fun fact, hyperglycemia is a medical term for high blood sugar level. There are two types of diabetes, type 1 and type 2. Type 1 diabetes. It is an autoimmune disease, which is a type of disease that causes the body to attack itself. If you are living with type 1 diabetes, your body cannot make insulin properly. This is because your immune system has harmed the insulin-producing cells in your pancreas. Type 2 diabetes. Your body has become resistant to the effect of insulin. This means your body needs more insulin to get the same effect. As a result, your body overproduces insulin to keep your blood glucose levels normal. After many years of this overproduction, the insulin-producing cells in your pancreas burn out. How does insulin affect diabetes? Injections of insulin can help manage both types of diabetes. The injected insulin acts as a replacement for, a supplement to, and your body's natural insulin. People living with type 1 diabetes can't make insulin, so they must inject insulin to control their blood glucose level. People living with type 2 diabetes can manage their blood glucose level with the lifestyle changes and oral medication. However, if these treatments don't help control glucose level, people living with type 2 diabetes may also need supplemental insulin. Now you know the basic concept of insulin and how it affects diabetes. Stay tuned for more episodes of Health 101. Welcome to another episode of Get to Know Your Meds. Our topic for today are the different types of insulin, including their generic and brand names. So what are the different types of insulin? There are 4 types, namely the rapid-acting insulin, the short-acting insulin, the intermediate-acting insulin, and the long-acting insulin. So under the rapid-acting insulin, there are 3 generic names. We have insulin aspart, insulin glulicin, and insulin lispro. So insulin aspart is commonly available as one of the following brand names. We have Novolog, Novolog FlexPen, Novolog FlexTouch, Novopen Echo, and Fiasp. For insulin glulicin, Apidra is one of its brand names. And the third is insulin lispro, which is sold under the following brand names, including Admelog, Humalog, Humalog QuickPen, Humalog Junior QuickPen, and Admelog Solostar. Under short-acting insulin, there is regular insulin, which is also called human insulin. Its brand names include Humalin R and Novolin R. Under intermediate-acting insulin, there is neutral protamine hagedorn insulin, which is also called as NPH, with its brand names Humalin N, Novolin NPH, Gensolin N, and Silin N. And last, under long-acting insulin, there is insulin detamir and insulin glargine. For insulin detamir, its brand names include Levemir and Levemir FlexTouch. And then finally, for insulin glargine, its brand names include Lantus and Basaglar. So while each type of insulin has different brand names, they all help manage blood sugar levels in specific ways. Now, let's break down and differentiate each type by how fast they work, when they are strongest, and how long they last in your body. So the first type of insulin is the rapid-acting insulin, so it is usually taken right before a meal. As the name suggests, it works rapidly, starting in about 15 minutes and is strongest after an hour. It lasts for 2 to 4 hours in our bodies and is often used with long-acting insulin. This type is the regular, or also called as the short-acting insulin. It is usually taken 30 to 60 minutes before a meal. It starts working in around 30 minutes and is strongest in 2 to 3 hours. It lasts in the body for 3 to 6 hours. So fun fact, the regular or short-acting insulin is actually the only type of insulin suitable for infusion with normal saline due to its solubility characteristics and consistent onset and peak time. So the third type of insulin is called the intermediate-acting insulin. It is also called the NPH insulin, and this type mimics your body's natural insulin release. It takes about 2 to 4 hours to start working and is strongest in 4 to 12 hours. It lasts for 12 to 18 hours and is often used with rapid or short-acting insulin. And then the last type is called the long-acting insulin, or also known as the basal insulin. Usually, you only need to take it once a day as it covers insulin needs for about 24 hours or 1 whole day. It takes at least 2 hours to start working, and it doesn't have a sudden peak. It slowly releases over the day. It is often used when needed with rapid-acting or short-acting insulin. So now that you know the different types of insulin and their generic and brand names, it is important to consult with your doctor in order to know the type of insulin that works best for you. Other than that, I'll see you in our next episode. Bye!
shedding light on the different medications that can be given or mixed with it. Did you know insulin isn't always on its own? Doctors sometimes prescribe it with other medicines. This is called combination therapy. Let's talk about some of them. Metformin. This one's pretty common. This medication tells your liver not to release too much sugar and makes your cells respond better to insulin. It's effective and cheap at the same time. However, it might cause a bit of weight loss and some side effects like nausea, stomach pain, and diarrhea.
Metformin is a medication commonly prescribed to manage type 2 diabetes. It is available in both liquid and oral forms and may be prescribed with any of the following brand names: Fortamet, Glucophage, Glucophage XR, Glumetza, Riomet, or Riomet ER. Metformin comes as two different types of tablet: standard tablets and slow-release tablets. Standard tablets release metformin into your body quickly, so you may need to take them several times a day depending on what your doctor says. On the other hand, slow-release tablets work slowly, so you don't have to take them as often. It is advisable to take your metformin with a meal with a large glass of water to reduce the possible side effects that I have mentioned earlier. Remember, the tablet should be swallowed whole with a full glass of water. Do not crush, break, or chew it. Lastly, metformin can take up to 1 to 2 weeks before your blood sugar control improves, but the full effect may take up to 2 to 3 months.
Sulfonylureas like Glucotrol XL, Amaryl, Diabeta, and Glinase. These medications make your pancreas release more insulin. They're very effective, not to mention very cheap. But just like other medications, there are possible side effects to be aware of. Watch out for sudden drop in blood sugar that can lead to hypoglycemia or a very low blood sugar level, weight gain, skin rashes, and if you drink alcohol, you may experience nausea or vomiting. Just a friendly reminder, thiazolidinediones like Avandia and Actos. These medications help your cells respond better to insulin and tell your liver not to produce too much sugar. Good thing about it is it might slightly boost your good cholesterol, but watch out for some possible side effects like gaining weight, swelling of your extremities, increased risk of broken bones, and heart problems including heart failure. If you're on pioglitazone, there's also a possible increased risk of bladder cancer. Just so you know, if you've got liver problems or a history of heart failure, this might not be the right diabetes medicine for you. SGLT2 inhibitors like Invokana, Forxiga, Jardiance, and Steglatro. These medications tell your kidneys to let go of some sugar so it comes out in your urine. They might help you lose some weight and bring down your blood pressure. However, possible side effects include urinary tract infection or a yeast infection. DPP-4 inhibitors like Onglyza, Januvia, Trajenta, and Nesina. These medicines are like traffic controllers in your body. When your blood sugar is getting too high, they signal your body to release insulin. They also tell your liver not to make too much sugar. They are effective because they won't make you gain weight and also won't drop your blood sugar too low, especially if you're using them with metformin. However, you might get a bit of a cold like an upper respiratory tract infection or a sore throat and headache as possible side effects. GLP-1 receptor agonist, also known as incretin mimetics like
Trulicity, Byetta, Bidurian Besides, Saxenda, Victoza, Adlixin, Ozempic, Ribelsus, and Wegovy.
These medications signal your body to release insulin. So when your blood sugar is on the rise, they tell your body to let out some insulin. They are good in a way that they make you feel less hungry and you could even lose some weight. However, you may feel nauseous or you may experience diarrhea and abdominal pain. There is also an increased risk of having an inflamed pancreas, a condition known as pancreatitis. Nonetheless, always remember to consult your doctor when taking other medications with insulin. Thanks for joining me on this episode of Pharma Facts! Stay updated for more videos by subscribing to our channel. See you in the next episode. Bye!
Hi! Welcome back to Insulin 102. For today's topic, we will learn the proper administration of insulin. Before we show you how to administer insulin, let's first talk about the different insulin injection devices. The main choices are the following: the insulin syringes, insulin pens, and insulin pumps. Insulin syringes are the most popular tool for injections. They come in different sizes, with 100 units in 1 ml being the standard size and the most commonly used. Insulin syringes are single-use only, and healthcare providers assist in determining the appropriate syringe and needle size for each individual. Next type of insulin injection device is called an insulin pen. These pens, which can be disposable or usable, are specifically made for use with a particular brand of insulin. Disposable insulin pens comes with the insulin already loaded and are thrown away when they're empty, have been out of the fridge for a month, or reach their use by date. Reusable insulin pens need an insulin cartridge to be inserted. Once the insulin is used up, the cartridge is replaced or pen filled with a new one. These reusable pens are designed by the insulin companies to fit their specific brand of insulin cartridge or pen fill. Another type of injection device are insulin pumps. An insulin pump is a tiny programmable gadget that carries a supply of insulin and is worn out on the outside of the body. Pumps function by storing rapid-acting insulin to provide a steady amount throughout the day and extra doses before meals. People can change the insulin amount depending on their blood sugar levels, food intake, and activity. Insulin pumps offer significant benefits for children with type 1 diabetes and other users, including precise insulin level control, minimized blood sugar fluctuations, fewer needle pricks, which is every 3 days, and increased freedom in daily activities, and in improved long-term blood sugar management. Now, let's talk about the different injection sites for insulin. Insulin is typically injected into the fatty tissue just under the skin, a method known as subcutaneous injection. Other common injection sites include the belly. The fat under the skin in the belly is a usual and light spot for insulin shots. It helps insulin get absorbed at a steady rate. Next is the leg. Another choice is the outer part of the leg around 4 inches above the knee. Then the arm. The back or outer part of the upper arm can be used but it is not as common. Then the behind. The fat under the skin in the buttock is another option, but it's not used as much because it's harder to do yourself and insulin is absorbed more slowly there.
Now that we know where to give insulin shots, we can get ready to actually give the insulin. Know what type and dose of insulin is to be used.
Next is to gather your supplies. Make sure you have everything you need, including the insulin vial, insulin syringe or pen, alcohol swabs, and a sharps container for used needles. The next step is to do hand hygiene. This is done by washing your hands really well with soap and water. The next step is to check the insulin. To do this, check the expiry date and make sure the insulin looks clear and doesn't have any weird stuff in it. If you are not sure, ask your healthcare provider. After making sure the insulin is clear and good to use, it's time to choose a site to inject. Those sites are usually the fatty part just under your skin. And these areas include the abdomen or belly, upper arm, thighs, and buttocks. It is also important to change the injection sites every time to keep your skin healthy. Next, get the insulin ready by first cleaning the cap of the insulin vial. Then, if you are using an insulin syringe, remove the 2 orange caps which protect the needle and the plunger. After that, pull back the plunger to draw in an amount of air that is equal to your insulin. Then insert the syringe in the bottle, then inject the air. And then after that, obtain the recommended amount or dose of insulin. After preparing the insulin, clean the injection site. Use an alcohol swab to clean the injection site and let it air dry. Finally, after cleaning the injection site, it's time to inject. Hold the syringe or insulin pen straight up, like a letter L with your skin or like your doctor told you to. Stick the needle in smoothly and push the insulin in slowly. After that, pull the needle out gently and press on the spot with a clean cotton ball or gauze. Put the used needles and syringes in a special container for its safety. Don't throw them in the regular trash. Lastly, check your blood sugar. Do what your doctor said about checking your blood sugar after you give yourself insulin.
For the administration of insulin pumps, the steps are a little bit different. The first step is to fill the reservoir. Get insulin from a vial or put the fresh cartridge into the pump. Watch out for air bubbles. We don't want them in there. Next step is to attach the infusion set by connecting the tubing with a little tube to the pump. Then, press the pump buttons to make it get rid of any air in the tubing and pump. Now, it's time to insert the cannula. The body area must be clean and dry before proceeding. Wipe the area with an alcohol swab. Next, pull off the paper backing on the adhesive. Carefully remove the needle guard from the introducer needle by gently twisting and pulling it off. After that, put the inserter over the area you selected for your site. Make sure that the adhesive is stuck on well. Then, remove the introducer needle by pulling back on these white tabs. After putting on the pump, set the rate. Unlike shots, the pump gives a small amount of rapid-acting insulin all the time. Adjust how much it gives based on what you need. Give yourself a shot of insulin when you eat or need it. Just press a few buttons on the pump. You can switch where you stick the tube every few days. Keep the pump full of insulin, either from a new cartridge or a bottle. Lastly, don't be scared to use pumps. Remember, at first, your health team helps set things up. As you get the hang of it, you can change the settings to fit what you need. Thanks for tuning in to this video. We hope you learned a lot today. Check out our channel for more videos like this. Bye!